So good afternoon, Mayor Pro Tem and council members. Again, a pleasure to be in front of you and presenting the latest on COVID-19. I have Dr. Urbina with us today, along with Sarah Mock and Helene Lanzer again to answer any specific questions, but quite a bit of information to provide and update you on as far as things that transpired last week. So I'll try and go through them fairly quickly so that we can make sure we have enough time for questions and answers. So Sarah, if you go to the next slide. So as far as case rates, we had 47 additional cases from the previous week. Thankfully, no additional hospitalizations and no additional deaths. And our percent positivity went down 1%. We're at 3.6% right now. So we're seeing all the trends head in the right direction, and I'll talk to why this is happening or later in the presentation. So next slide. So again, as a reminder, we're measuring the 14-day moving average for hospitalizations now that we're in level clearing. You can see at this point, we're at a very good place as far as our 14-day average, so no concerns there. Next slide. As far as the statewide Epi Trends, we're seeing that cases and percent positivity have recently begun to decline, but we are seeing some variations across the state, such as in Mesa County, down in the southwest San Luis Valley, seeing some increased incidence of cases. We also know that there's more and more data coming out to show there's a clear correlation between county vaccine rates and case rates. We are seeing, though, that there is more B117, and I think this is just due to our enhanced genetic surveillance system, and that we're capturing more of those cases. Our case rates in the state are highest among middle school and high school students, and hospitalizations appear to be more stable. And then our deaths over this fourth wave, we saw a slight increase in deaths. And lastly, you could see the slides on our outbreaks in long-term care facilities. And Helene spoke to this last week as far as what we've been seeing in the Broomfield long-term care facilities. So next slide. So this is what I was pointing to, and they actually included Broomfield in the most recent data analysis as far as the correlation of increased vaccines or people that have been vaccinated and the case rates. And what you can see is there's an extremely strong correlation there. And as I mentioned before, Broomfield's been leading the metro area as far as in our vaccine rates. And you can see this now corresponding with case rates. And that's, I hypothesized last week why I believed that was happening. Now we actually have the data to show that's the case. So it's good to see that. And then next slide. And we are seeing the same thing with the hospital trends. And you can see again, those counties that have higher share of their population that's fully immunized has less hospitalizations. I'd say the one caveat with our data, Broomfield, is we have such small numbers with hospitalizations that we could see that sort of fluctuate. But if you look at the large counties, it's extremely clear to see that as much as we're seeing the trend in case rates, then you would also see that follow with a decrease in hospitalizations. And we expect to see this continue as hospitalization is a lagging metric. Next slide. So as far as where we stand in Broomfield, we have a sustained decline in cases and incidents. We're currently at 66.4 per 100,000. Which is one of the lowest we've been in for a long period of time for our weekly incidents. Our positivity, as I mentioned before, is down to 3.6%. We still see high number of cases in our 20 to 29-year-old population, but we are seeing that the cases among the 10 to 19-year-old population appears to be slowing. As far as vaccine progress, 61% of our total population have initiated or completed the vaccine. And I want to remind you, this isn't the population that's eligible to receive the vaccine, it's the entire total population of the city and county of Broomfield. So again, shows that we're doing really well there, given that there's a certain segment of our population that isn't even eligible yet to receive the vaccine, or vaccines, I should say. And then 9.6%, this is really good news, or about 400 of our 12 to 15-year-olds in Broomfield have already initiated receiving the vaccine. You'll recall that was just approved last week by the FDA for that population to become eligible. And as far as our variant cases, again, we're seeing what's happening in the state, mainly the B117 and the B1427 variants. Thankfully, we're not seeing any increases in the Brazil P1 or the New York variants. Next slide. So as far as major vaccine and policy updates, I'm sure everybody has seen this, but we wanted to dive into it a little bit more. The Pfizer vaccine, as I mentioned before, was approved for use by the FDA and the Advisory Committee on Immunization Practices for 12 to 15-year-olds. We're already seeing it distributed to that age group. And then the CDC issued the guidance for fully vaccinated individuals and what that means for mask wearing or face coverings. And I wanted to hit a couple of key points in the data, because the data has really been driving decision-making, both happening at the CDC, at the state, and we've been using the literature and the data to drive our decision-making here in Broomfield. So the preliminary evidence suggests that the COVID vaccines providing some protection against the variety of strains we're seeing circulating in the nation. There's a growing body of evidence that suggests fully vaccinated people are less likely to have asymptomatic infection and potentially less likely to transmit COVID to others. And a lot of that has to do with the viral load that Dr. Rabinik could address if you have questions around that. They have looked at some modeling studies that suggest that the prevention measures such as mask use and social distancing will continue to be important during vaccine implementation. And why this is important is we still have some members of our population, those that are immunocompromised, certain segments of our adult population that still haven't received the vaccine. And obviously, we're just beginning to vaccinate our 12 to 15-year-olds and then the 16 to 19-year-olds that have received first doses and starting to receive their second doses. So we're not all the way there yet with everybody being fully vaccinated, and we just need to keep up some of those prevention measures for others. But at this point, the CDC has made it clear that if you are fully vaccinated, based on the data and the literature, you no longer have to wear a face covering or a mask. And the reason for that is your risk of transmitting it to others is extremely low. Your risk of contracting it is extremely low. And then again, your risk of coming down with severe illness or death is extremely low. And again, we know that it's not 100% effective, but we're seeing that it is highly effective. Next slide. So as far as the state followed suit once the CDC updated their guidance, and the state mask order was updated on May 15th. and it was updated. So I do want to mention we still do have a state order in place. I think that when the announcement was made, there was some questions or assumptions that do we still have an actual order? And yes, there is an order. And what it does is fully vaccinated people can go without masks in public indoor spaces unless the setting requires otherwise. So there still might be some businesses and some other areas where they are requiring, got an Excel spreadsheet up here, they are requiring individuals to wear masks, probably for the reasons I was talking about before. Obviously, there are certain settings where you still want to have masks or face coverings in place where you cannot differentiate those that are vaccinated and unvaccinated. As far as those areas where it is still required is preschool through grade 12. And there are some certain exemptions, but for the most part, what I've been hearing from our school districts is given how close they are with the end of the school year, they're probably going to just keep universal mask wearing in place. And I fully support that decision because given the complexities of having to determine who is vaccinated, who's not vaccinated, and all of those other situations, and the fact that we're so close to wrapping up the school year, it makes sense. The other areas, unvaccinated or not fully vaccinated staff at the Division of Motor Vehicles, unvaccinated or not fully vaccinated resident staff and visitors to congregate care facilities. You can see again, unvaccinated or not fully vaccinated resident staff and visitors to prisons, the same for jails. And then again, unvaccinated or not fully vaccinated personnel in emergency medical and other healthcare settings. And so if we go to the next slide, Sarah, so as far as what this means for Broomfield, a couple things is, as you know, Broomfield and the metro area were poised and did move to level clear on the May 16th. Broomfield was currently following the state mask order and will continue to follow the state mask order even with the updates. The rest of the Denver metro region is going to, my understanding, align with the state mask order. So the entire metro area will be following the same order. And then as far as the city and county of Broomfield, we had a discussion with our city manager's office, and we've decided to update our policy as well to follow the state mask order just for consistency purposes. As far as vaccine updates, we are doing clinics specifically out of public health that are targeting 12 to 15-year-olds, and our next one is on May 18th. We are having our second dose Pfizer clinic on May 20th at First Bank Center. So you'll remember we're no longer doing first doses, but we're moving to second doses. However, walk-ups are accepted for people needing either a first or second dose. So if we have parents out there that want to get their 12 to 15-year-olds vaccinated with Pfizer, this would be a great opportunity. We are seeing that clinics are continuing in Broomfield and around the metro area to provide vaccines, and there's ample supply right now. Anybody that wants a vaccine should be able to get one from a supply perspective. And I know the state has been really working on the convenience issue as well, and these clinics have as far as walk-up and hours, extending hours and so forth. And then lastly, the state has started a workplace vaccine program, which sounds really exciting. And we also had our team go out and do a workplace vaccine clinic last week, and it sounded like that went extremely well. I had one of our staff members today update me that there was one individual there that was a little bit on the fence in the workplace and wasn't sure going back and forth, and given the convenience of having it right there, decided ultimately to get the vaccine. And that's what we want to see with that convenience factor. So that's great news. And then the next slide, Sarah. So one thing I do want to point out is we are going to be changing our data and how we're presenting it as far as the percent of the population that's been vaccinated. As you'll recall, we've always been showing the percent of our eligible population who have initiated or completed their vaccines. And here you can see we're at 75.4% of our 16 plus population that have either initiated or completed the vaccine. And the good news here is we're still seeing in that red line as far as initiated, that line is going up. That's what we want to see. If that line starts to level off, then we're starting to see that the vaccine uptake is slowing down. So that's definitely a trend we'll keep monitoring. If you go to the next slide, this is the way we're going to start presenting it in the future to incorporate now the 12 to 15-year-olds. And so you'll just see that the overall percent of individuals that have been vaccinated has gone down slightly because we're increasing our N, or basically the number of people that are included in the overall pool that are eligible. And this should be uploaded on our website, I believe, tomorrow. So I think we have one more slide, Sarah. And again, just a reminder that Broomfield is in the observation period, level clear for 90 days, along with the rest of the Denver metro region. And you can see again, as far as face coverings, they may be required in certain settings, but it's no longer required for those individuals as a public health order from the city and county of Broomfield for everybody. I think with that, that concludes the presentation. So we're available to answer any questions council members may have. Thanks, Sarah, for clarifying that. So actually that information will go up on our website after this presentation as far as the overall vaccine status. So if you have questions, feel free to raise your hand. Councilmember Anderson.
Thank you. This is all good news, and I'm excited. My 14-year-old is getting vaccinated tomorrow. So yes, and her friends are getting vaccinated. So it's definitely being taken positively. I do have a question as we're moving into the summer and pools and different outdoor activities. There are no restrictions, right? There's no restrictions this year on pool capacity, outdoor activities. So, and is that being communicated to the HOAs that, so many of them, there were pools that didn't even open last summer. I just want to make sure that they are all feeling good about this and just know that they can open.
So that's correct, Councilmember Anderson. There are no longer restrictions in place. And my understanding is we have been reaching out through Deb and others to our key stakeholders, including the HOAs, but I'll verify that. Deb's actually on a she got a well-deserved day off, and so when she gets back, if not, I'll make sure we're following up. We will continue to obviously provide public health guidance to those facilities, but as far as requiring any of those other capacity limits and so forth, those are no longer in place in level clear.
Thank you. I suppose if it goes from level clear, then that would be communicated that there are whatever the limitations, but that is, I think this community just so badly needs to get back out and enjoy this beautiful summer that's coming. So thank you very much.
Thanks, Councilmember Anderson. Councilmember Hinkle, looks like you might have a question.
Sorry, I just asked a question in the message chat to you, just talking about there's still restrictions though on the unvaccinated, so we can't just always say like everything's unrestricted. So I just want to make sure that that's really clear. You know, because we went into the gym this morning and they're saying, you know, they're trying to thread this needle of yes, you know, we need, you know, to have people wear masks if they're unvaccinated. So you know, the wording on that, you know, and then having people say, well, prove it. And so I would just, you know, caution everyone to say that, yeah, we have restrictions in place for those who are unvaccinated, if that makes sense. Is that correct, Jason?
Yeah, so good point, Councilmember Hinkle. And again, I went through those areas in the state order where masks are still required. And again, the CDC recommendation is extremely clear. If you are not vaccinated or fully vaccinated, the recommendation is that you still wear a mask in those settings. And so when it comes to those specific situations, it'll now be placed on the individual to make sure that they're wearing that face covering other than those specific sectors that I addressed in the state order.
Okay. And then one really quick question about the ability to pass on the virus. There's some conflicting information about that. Can you just clarify, and maybe Dr. Urbina can maybe weigh in on this? Could we just get more clarification on, if you have the vaccine and you're fully vaccinated, what is your ability to get the virus and to pass it on? Because a lot of people are saying, I'm still going to mask up. I'm going to be passing it on if I get it. We've seen baseball players, get the virus and test positive. What does that mean? And what does that mean for people who have been vaccinated?
Sure, I'll turn it over to Dr. Urbina, but we did link to and we'll include the studies that the CDC referenced as far as that spread once you do have the vaccine, and potential for spreading it, either symptomatic or asymptomatic spread. As far as the New York Yankees situation, my understanding is they're still doing the investigation of that. But Dr. Urbina, do you want to specifically address that question?
Thank you, Jason. Thank you, Councilmember Hinkle. This is a very good question. If you remember, when we first got the vaccine, we said, remember, it's not 100%, and still want you to wear a mask, wash your hands, and have physical distancing. Now, over time, as we've gotten more and more people vaccinated, it is true. It's still very effective, extremely effective at preventing severe disease, hospitalizations, and death, but you still can get the infection. Although it's less likely, and they've done significant studies, as Jason alluded to earlier, and we can give you those citations, is that it's still possible for you to get the infection, asymptomatic or symptomatic. If it's symptomatic, it's going to be mild. So that means that you still can pass on the infection, although it's lower risk. And I think that has prompted people, and rightly so. I would encourage people, if they're still concerned, particularly if they have a household member who's not vaccinated, who has either immunocompromised or medical condition, they would want to wear a mask in those settings. And I think that's part of the recommendation from the state and the CDC, and particularly those vulnerable populations like long-term care, assisted living, jails, where there are particularly vulnerable folks, and it's very difficult to separate those folks. That's why those recommendations of putting masks on is still a good idea. And I hope that clarifies it. I just want to make sure that we understand that, you can still wear a mask. It reduces your risks, but if you're fully vaccinated, you don't have to wear a mask in those settings that Jason talked about. But of course, obviously we want to encourage people to continue to, we've reduced the amount of influenza and other infectious diseases by simple wearing a mask, physical distancing, wash your hands. Why wouldn't we want to continue to do that? So I hope that helps, Council Member.
Yeah, I often thought about just wearing a mask on airplanes from now on.
Not a bad idea.
Going to stop me, and it doesn't look so weird anymore. So yeah, I think it'll be helpful. I'll read into that study. Thank you, Sarah, for posting that in the chat. And I think people want to know like a percent of risk, like how much risk am I taking? So I think it'd be good for people to know that too. Thank you.
Yeah, thanks, Councilmember Hinkle. And another thing we'll include is, based on the science and the epi literature, what are those high-risk settings? And the CDC updated their graphic when you should mask up in certain settings based on the potential risk, especially, again, if you're not fully vaccinated or unvaccinated. So, Councilmember Lim.
I guess I'll follow up on that first with, it's good news that, Broomfield's cases are down. What I was seeing though, there was some news coming out that there's a lack of transmission control in other counties throughout the state. and that there's the Colorado modeling group that's been doing the modeling is predicting we're not going to be in such a good position by July. So, would Dr. Urbina or someone else want to, speculate on what does that mean for Broomfield? I mean, we're in a very good place right now, but if the rest of the state is not having adequate transmission control, what does that mean for us in the future, I guess?
Sure. I'll take a stab because I've been looking at that data closely, and then I'll let Dr. Urbina weigh in. So again, based on the scientific literature and what we know, again, if you're fully vaccinated, so if we look at our Broomfield residents and this trajectory we're on of residents being fully vaccinated, if we're seeing less transmission control in the rest of the state, there might be more cases and transmission going on. We're not going to be seeing that potentially for our fully vaccinated individuals here in Broomfield, but for those individuals that are not vaccinated yet, again, our children, school-age children specifically, we want to probably still take those appropriate precautions. And then the second thing is, what we know is if we don't have, and that's why we're encouraging everyone to get the vaccines because they are safe and effective, is if we don't have that full protection in the entire state, nation, across the whole entire country, it just creates that opportunity for more variants to come up. And that's what we don't want to see happen. Dr. Urbina, go for it.
Yeah, that was the only thing I was going to add, Jason, to your comments, was that as long as we have virus circulating, there's a greater chance of having mutations and variants. And those variants could be less susceptible to, obviously are more contagious. We know that about B117 and the South African variants, but more mutations mean potentially less effectiveness of the vaccine. So that's why we're putting a big push on vaccinating so we can eliminate that. And I think the guidance is reasonable. We were encouraging people, obviously we're not going to, viruses have no borders. And so we're going to encourage people to wear a mask in settings where they're unsure about the vaccine rates in their communities.
My next question then is about the 12 to 15-year-olds. So I saw something that our clinic that you mentioned on May 18th filled up very quickly. Is that true? And then are we going to repeat that clinic just for the 12 to 15-year-olds? Are we anticipating from now on they're going to go to their pediatricians, to their schools? What's the future of that vaccination scene for them?
Sure. Helene Lanzer, who oversees our vaccine programs on. So Helene, you want to take that one?
Sure. We're, can you guys hear me?
Yep.
Yep. There. Yeah, we're a combination of things. So we definitely have been working with our pharmacies to expand more appointment times and have been figuring out if there's any schools that are interested in doing something on site. It seems like kind of with end of the year events and such, it's not that they're not quite looking for on-site events. So we're looking to just kind of figure out what providers are participating. There's quite a lot of providers that do have Pfizer on hand, and then the additional spots in our clinic as well as in other events that we have coming up. So definitely trying to make sure the information is out there, that there's other clinics opening, as well as walk-ins are now. You should be finding all pharmacies are having walk-ins, and that kind of shifted this, I'd say probably over this current week. So all of those modalities should hopefully help with access.
That sounds good. My last question is, how are the Broomfield businesses doing, I guess, that Jeff would have been talking to, with sorting out, are we going to continue our own mask requirements or not, as a business? How is that getting fleshed out in conversation that, should residents expect that it will be clearly posted when they go into a business, whether a business is continuing mask wearing, or what should people expect in Broomfield?
Council member, what we communicated on Friday with the information that Jason had been sharing concerning both CDC and the governor's changes. to let them know that the conditions exist where the governor's order still sits in place. And so most of the businesses, as I think one of your colleagues had pointed out, such as the fitness centers, are still requiring masks and trying to ensure that as best they can. It's a difficult situation for them because that compliance issue, that hey, show me your card thing is a step for many of them. So they are right now, the ones that at least I've talked to, which is 6 or 7 on Friday, all indicated they were going to stay in place with masks just because of the employee side of it, and trying to encourage that. So I think the best indicator, because we don't have anything further than that, is if the businesses are encouraging their employees to continue to wear them when you walk in, they are encouraging their customers too, but they are not going to be, many of them said they are not going to get into that compliance side. They have a difficult side. And that's something that Deb and Jason and I talked about 2 weeks ago when we saw this coming, or maybe 3 weeks ago. I don't remember anymore. But the burden of enforcement is difficult for a business in this particular way that it's drafted.
Okay, thank you for that. Those are my questions. Thanks.
Thanks, Councilmember Lim. Mayor Pro Tem.
Thank you, Jason, and thank you, guys. I'm happy to see that, the trajectory is still going up, though the plateau is there. So I want to talk about incentives and nudging people and what we can do to, incentivize people to take the shot, because, they're giving away money, donuts, beer, all over the place. I know you've seen some of the campaigns that actually are working. So do we have any plans to do some type of nudge campaigns or incentive campaigns?
Yeah, so we have been watching what's happening across the country, and then also even the state has begun to look what they could do as far as waiving certain license fees, hunting license and stuff like that. Helene, I know we didn't have a chance to touch base last week, so do you want to talk about how we're looking at incentives and the potential for using those going forward?
I think it's a little, I'm open for creative ideas. I'd say that with the overarching, it's really interesting, like the lotto that was it Ohio or somewhere is doing. So that's pretty neat. I think, for our Epi business team that we have, we've definitely tried to put some feelers out. And I know some of the grocery stores, it's interesting, some of the grocery stores have already been offering like $100 stipend, but have seen low turnout. So it's really trying to figure out what is the other kind of reasonings there. So it is kind of, it seems like some of the fun things are like, get a beer or get something else, could be worth thinking about of other activities. So it's an interesting mix happening now, and I think it will kind of help reel in a few more maybe that are on the fence.
Well, I'm going to volunteer everybody here. No, I'm just kidding, on council. If you want us to work on, PSAs or something like that to help, demonstrate responsibility and taking care of each other, I'm happy to help.
Thanks,
Yeah, and
Mayor Pro Tem.
I was just going to share just some of the other feedback of when we were out at the business last Friday. I'd say one of the most common things that's interesting is people are very nervous about the side effects, and especially the second dose side effects. So I think that's still a lens to try to just help get the word out where, we don't want to mislead people. So, we know not everybody, but a lot of people are probably not going to feel great on that second day, but it is usually just for 24 to 36 hours. And, but that was the most common comment I heard in terms of why they're really on the fence. I'm really worried about the side effects. I'm really worried about the side effects. Specifically just like of the second dose, which was interesting.
Well, and having possible downtime from work, which some people can't afford to do. So maybe there's a way for, our employers to offer that day off.
I'm going to take it back, Mayor Pro Tem, to our communications team, because they're so creative along with Jeff, and figure out what we could do to get the information out there, and specifically from the incentives point of view, because we are getting to that place. So appreciate you offering that up.
We did offer autographed pictures of Jason, but that didn't go very well.
That's a disincentive, not an incentive.
I am one of those lucky people that just had a sore arm both times and no other side effects. But my wife had the whole gamut. You know, we did it at the same time. So you just never know. But I do want to comment. Thank you, Dr. Urbina. The infection has a lot worse side effects as well. So, yeah, thanks for that. But let us know what we can do to help.
Definitely. Thanks, Mayor Pro Tem.
Mm-hmm.
Councilmember Grimm, I believe you're up next.
Thank you. I was going to ask again about the other virus strands and see if they are being, if they're more contagious or if they're being seen as a second case of coronavirus or if they are still first case coronavirus. And where are we seeing them most frequently, first case or second case?
Dr. Urbina or Helene, do you want to take that one?
Sure, I'll start, and Helene, please add. Councilmember Groom, we're all concerned about this as well. You know, clearly we know that several of the variants, and now the variants are now predominantly the increasing number of cases in Colorado, particularly among unvaccinated folks. So we know that the vaccines, when they were first tested, were tested against the predominant strain. We still know, and the CDC has confirmed this, and we've had multiple studies that have confirmed that the vaccines are effective against the variants as well. But that is our concern, and we're concerned not only for breakthrough infections with the vaccinated folks, but the folks that had the virus many months ago now, over a year ago, that those folks, their natural immunity may be waning. And that's part of the concern right now at the federal level. So they're exploring whether or not we need to add a booster to that initial vaccine, or they're a booster to their natural infection or a booster to the original vaccine. So we're looking at all those studies right now. We don't have really complete data. So I can't give you a number that says this is exactly the number that we're seeing in those second infections or infections post-vaccine, but we're tracking that very closely, and hopefully in the future we'll be able to share more data as we have that more information. And that's partly why we still want to recommend masks, physical distancing, and hand washing, and people get the vaccine so we can reduce the spread of infection. Helene, I don't know if you have anything to add to that.
That was the kind of, you hit on the overarching, is that we are still collecting data on it, and I know we are monitoring if we do have anyone that has, it's been very minimal, small numbers in terms of vaccine breakthrough, but if that is identified, we have a few handful that we have then work with CDPHE on in terms of trying to figure out where does that fall in terms of a first or second case. So I know that's not always the satisfactory answer, but in terms of just still researching it and still kind of gathering more info.
Perfect, thank you. And then I guess another question that I had a few weeks ago that I'm still concerned about is the herd immunity. I know we're doing fantastic here in Broomfield, but I know throughout this entire analysis, it's been, where do we establish our metrics? Do we establish them in Broomfield? Do we establish them in the region? Do we establish them at the state level, in the country level, in the, and that's, now we're looking at it as where do we establish herd immunity? Because that to me is like world population. Where do you guys professionally think that that is a safe line for us? Like at a state level, should we be looking at herd immunity? Do you think that's a wide enough net to cast and analyze for herd immunity percentage?
Yeah, it's a great question, Councilmember Grimm, and it's a difficult one to answer because the metric for herd immunity is between a range that you hear from various experts, and even Dr. Fauci himself will say between 70 to 80%, but he says don't really focus on that herd immunity metric or number. And the reason for that is the factors that play into it. So you have the vaccinations in addition just to natural immunity that's playing into it, but then you also have the potential variants and how they could impact herd immunity when you set a metric like that. And so it's a number that I wish we could say it's 70, 75%. I know various agencies have put numbers out there. Really what we're looking at is at what point do we start to see those case rates drop significantly and not go back up again? And when we start to see we're back to a place where the virus from a point of view is manageable, similar to other traditional virus or reportable condition, then we'd be managing it more in that similar fashion. So I would say some of this is going to have to evolve from the World Health Organization, from National Institutes of Health, CDC at the state, and just see what that community transmission rate continues to look like in Broomfield. And Dr. Bean or Helene, feel free to weigh in on anything I may have missed.
No, I think, Jason, you're right on. I think it's a guess for us. And we're going to try to vaccinate as many people as we can and reduce the amount of spread of infection in our communities.
Sure. I guess, let's just say we get to 90%, are we still pushing? And I get that's kind of the conversation is what number is going to be a good number, but I get that we don't want to put a number on it right now. And then my last question was a question that a resident asked me, and I didn't know how to answer it in regards to the clear and the hospitalization. I guess if you did the calculation, if we had 2 people, the question was posed to me as kind of a statement. The individual did the calculation and she said if we had 2 people hospitalized in Broomfield, that we would go from clear to blue. And it didn't seem right, but I didn't on the spot have the ability to do a calculation. So I thought, well, I'll just wait and ask Jason. So Pauline, what would your reply be? How many people do we need to go back to clear? What would be that metric for us?
Yeah, Councilmember Groom, I don't have the specific metric in front of me, but I could tell you that having 2 hospitalizations wouldn't be what kicks it over. We're looking at a 14-day rolling average of hospitalizations per 100,000. And Sarah Mock, who's our data guru, is the one that's been tracking that for us. And what you can see from that first graph that we put up, when we were at a place to moving back into a level blue was more in the November, December peak as far as hospitalizations. So Sarah, anything you want to add to that?
Yeah, Sarah, what would it take if somebody asked me that again? What would it take for Broomfield to go back through?
It's 2 to 3 hospitalizations within our 100,000 per 100,000 population, and that's the metric that the entire metro has agreed to. And I think the thing that Jason, I'm sorry, I was half listening to what Jason said, I'll admit. It's a precursor, that it's not the only thing that's being considered, is so that it's an indicator, a warning sign that things are not going well. And we know
that would have to happen over, that statistic would have to happen over a 14-day rolling average.
That's correct.
So it's not like 3 people are put in the hospital overnight and Broomfield goes back to clear. Correct. That would have to be a rolling average over 14 days.
Yes.
That's okay. Perfect. Thank you very much. That's all the questions I had. I appreciate it.
Thanks, Councilmember Grimm. Councilmember Anderson.
I do have a sort of a question that as Councilmember Groom was talking about herd immunity, and we talked about this a couple weeks ago. What percent do we know? Do we have this number still? Of like what percent of Broomfield's population is 11 and under? Because that's the group that now can't be. That's got to be 10, 15%. So it's like we still, in order to get to that herd immunity, we really need this all-out effort of all the people that can get immunized. I think that message still needs to be out there in the front that it's going to be hard on the overall population until the next group can be immunized. It's going to be, we really need everyone who can do this to do it. And then do you know what the status of 11 and under for vaccinations is? Is there testing underway for that now, or is that a long ways off?
So you're exactly right. And Sarah may have the number, but I can tell you that in order for us to get to that level of seeing everybody have the opportunity to get vaccinated and not seeing that transmission occur, we have to have our 11 and younger population be eligible to get the vaccine and get fully immunized. So we'll have to wait for that to come out. And so keep precautions in place, obviously, for that age group. Regarding the studies, I would have to defer to Dr. Urbina or Helene if they're aware of where things are at as far as vaccine studies in that age group.
Sure, those trials are going on right now. Moderna is doing their vaccine 12 to 15 as well, and both major companies are also doing the 2 to 11. And so those kids are enrolled now. The good news is that so far the preliminary data says that they're highly effective as well as safe. So that's reassuring. But the date that I've seen most often in the national literature is September. For the kids 2 to 11, that could be pushed up earlier, that could be pushed later, but that's certainly encouraging because that's fall, right? Potentially we could get our kids immunized just after or soon after the school starts. So that's very encouraging, I think. I don't know, Helene, do you know anything more than I don't know?
Yep, you said it perfectly. I've heard fall, so September kind of on through the fall, but it's agreed, promising, and we're excited. And hopefully that continues on a good timeline.
Well, thank you for that. And I'll add one final comment to this, just for, as businesses are moving forward, I have my 10-year-old who will continue to wear a mask in public. And I've been fully vaccinated, for a month now, but I will still wear my mask wherever I go with him on public. I'm not going to make him just do it himself. So we'll still be masking up.
That's perfect.
Yeah.
Thank you for doing that, Councilmember Anderson. I think we have to realize that not everybody has the opportunity to remove their face covering. So us being gracious to each other as a community is probably the most important thing we can continue to do as we wait for the rest of our population to be eligible and have that opportunity to get vaccinated. And the last thing I would say regarding the vaccines too is I think the NIH also had announced they're working on a pan or more of a universal vaccine that covers a variety of coronaviruses. So not having to address this on each one-off situation, but something that's more universal. So as more research comes out in this new and exciting platform and technology they have, hopefully that will help us in the future. And I don't see any other questions, so I guess I'll do one last call. Well, with that, I think Councilmember Anderson wrapped us up on a very high note, and I would encourage us all to keep that same perspective as we continue to move through this next iteration of COVID-19 and what it means for our community. We're making great progress, still have some work to do, but we're getting there, and really it's been the community and all of you that have contributed to that. So thank you so much.
Thank you, Jason. Thank you, team.
Have a great week.
Yeah. See y'all soon.
Thank you.